Okay, so if you ever like tripped and fallen, or just maybe grazed your knee,
Happens to the best of us.
yeah, we've all been there. But have you ever thought about, um, I don't know, like the amazing process that like happens when you break the skin,
It really is remarkable.
right? It's like a microscopic construction crew gets to work right.
Exactly.
Yeah.
Rebuilding, reinforcing, getting you back to 100%.
Yes. So today we are going on a deep dive all about wound care.
I love it.
We're going to use a presentation aptly titled Wound Care.
Can't go wrong with that title.
Exactly. And we're going to talk about layers of the skin, different types of wounds, and then the stages of healing.
All the good stuff.
It's a lot to unpack, so let's dive in.
Let's do it.
Big shout out to London Heartbeat C Academy UK.
A wonderful resource.
They're providing the educational material for this deep dive.
Fantastic. And I always encourage people to check them out.
Yes, so be sure to explore their website. Over 150 amazing courses.
You can't beat that.
And they have social media channels too, so be sure to subscribe. Facebook, Instagram, Spotify, and YouTube
All the big ones.
for free updates so you don't miss future discussions like this one.
Definitely subscribe. Stay in the loop.
Okay, so the presentation opens with a reminder about something that, we kind of take for granted, our skin.
Right. We don't think about it much.
Yeah, and there's like this basic diagram showing the layers.
Yeah.
Epidermis, dermis, and subcutaneous tissue.
The classics.
Yeah, like total bio flashback.
Takes you back. Right.
Yeah, total.
It is easy to forget just how complex our skin really is.
Yeah.
It really is. It's such an incredible organ. It's like a dynamic shield, constantly protecting us from the outside world.
That's exactly how the presentation describes it. They say that skin is our, quote, first line of defense.
I mean, it's true.
Yeah, but like what makes it such an effective barrier?
Well, it all comes down to the layers working together,
All right.
The epidermis, the outermost layer, it's like a self-renewing brick wall, always shedding old cells, replacing them with new ones, and that helps keep out all those nasty pathogens and also regulates moisture.
Makes sense.
And then you've got the dermis, the layer underneath, and that's like the scaffolding, providing strength and flexibility thanks to collagen and elastin.
Okay.
We can't forget about the blood vessels and nerves in the dermis. They're crucial for, keeping the skin healthy and responsive.
Makes sense.
And then finally, we have the subcutaneous layer,
Okay.
and that's like the insulation.
Yeah.
It's mostly fat and connective tissue,
Okay.
and it acts like a cushion, protecting us from, bumps and jolts.
So 3 layers, each with a specific job to do.
Teamwork makes the dream work.
Exactly. But like, not all wounds are created equal, are they?
Oh, absolutely not.
So the presentation talks about partial thickness wounds and full thickness wounds. So what's the difference?
So think of it like a paper cut
Okay.
versus like a deep gash.
Okay. Ouch.
Yeah, so a partial thickness wound, that's like your paper cut. It affects the epidermis and maybe a bit of the dermis, the upper dermis.
Okay.
And it's painful, but it heals relatively quickly because those top layers regenerate pretty easily.
Okay.
Now, a full thickness wound, that's like your deep gash, and
Yeah.
that goes through all the layers,
Oh, wow.
potentially exposing muscle or even bone.
Oh, that's intense.
Yeah, those are a lot more complex and require, a very different healing process.
That makes sense. And this actually leads right into the next section of the presentation, which is all about a specific type of wound. Pressure ulcers.
Very common, unfortunately.
Right. And they actually define it in the presentation as a, quote, localized area of tissue breakdown between bony prominence and external surface. So what do we need to know about these?
Well, what's interesting here is that the damage that you see on the surface, that's often just the tip of the iceberg, so to speak.
Oh, wow.
The real problem is actually in the deeper tissues.
Yeah.
So imagine a building
Okay.
with a crack in the facade. It might look minor, but if the foundation is compromised,
Yeah.
the whole structure is at risk.
Right. That's a great analogy.
So even a small pressure ulcer could actually indicate significant damage beneath the surface.
So that little surface wound could be deceiving.
Exactly. It's what's called the iceberg effect.
Okay.
And prolonged pressure, that actually disrupts blood flow to the tissues.
Okay.
Think of it like a kink in a hose.
Yeah.
And that actually leads to cell death.
Wow.
And the visible ulcer, that's just the outward sign of that deeper damage.
Okay. And how quickly can that damage happen?
Really quickly, surprisingly quickly.
The presentation says that a pressure ulcer as deep as a U.S. nickel, is already considered stage 3.
Yeah, it can progress really fast.
Wow, so it's like a ticking time bomb almost.
Yeah, it can be, and it's a good reminder of how important early detection is and intervention.
Yeah.
We often associate pressure ulcers with, like, bedridden patients.
Right.
But they can occur anywhere there's prolonged pressure on the skin.
Yeah, anywhere.
Even something as simple as, ill-fitting shoes.
Oh, wow, okay.
It's all about pressure.
Speaking of stages, the presentation goes on to talk about the staging system for pressure ulcers.
Oh, yeah, that's a key concept.
So you have stages I through 4V plus unstageable and suspected deep tissue injury.
It's a whole system.
It is. So how does staging work?
So the key thing to remember about staging is that it's about the depth of tissue loss, not necessarily the size of the wound or even how well it's healing. So think of it like assessing damage to a building after a fire.
Okay.
So a stage I pressure ulcer, it's like a little scorch mark on the wall, while a stage 5, that's like a complete collapse of the structure.
Wow, okay.
So it's about the severity of the damage.
Okay, so the higher the stage, the more extensive the damage.
Exactly.
So let's break down some of the visual cues for each stage,
Okay, sounds good.
starting with stage I.
So stage I, what you'll see is non-blanchable redness
Okay.
over a bony prominence.
Okay.
So that means when you press on the area, the redness doesn't fade.
Okay.
And that actually indicates that there's damage to the capillaries beneath the skin.
So that's like the first sign of trouble.
It is that non-blanchable redness.
Okay. What about stage 2?
Stage 2, you actually have a break in the skin.
Okay.
You have a partial thickness loss.
Okay.
So it might look like an abrasion, a blister, or a shallow crater.
So the damage is visible at that stage.
It is.
Then things get more serious with stage 3.
Yes, much more serious.
What happens?
Stage 3 is when the ulcer actually extends into the subcutaneous fat.
Okay.
So think of it like the fire breaching the walls and reaching the insulation.
Okay.
You might also see tunneling or undermining, which are basically channels that are extending from the main wound.
Okay, and then stage 4.
Stage 4 is the most severe.
Yeah.
The ulcer extends through all the layers,
Wow.
potentially exposing muscle, tendon, or even bone.
Wow.
The impact of this level of damage can be devastating, honestly.
Yeah, it sounds like it.
Leading to serious complications.
And they make it clear that you can't reverse the staging.
Right, it doesn't go backwards.
Oh, a healing stage 3 doesn't become a stage 2.
Nope.
Even if it's, starting to look a lot better.
Exactly, the damage has been done.
Okay, so we've talked about the stages of these pressure ulcers, but the presentation doesn't just focus on the problem, right?
Right.
It gives us a strategy for prevention
Yes.
with a handy mnemonic, skin.
Ah, I love a good mnemonic. Makes it so much easier to remember.
Exactly. So easy to remember.
So what does SKIN stand for?
Okay, skin stands for surface, keep moving, incontinence management, and nutrition.
Okay, I like it. Nice and simple.
Exactly. So let's break down each element,
All right, let's do it.
starting with surface.
Okay, so when we talk about surface, we're really emphasizing the importance of reducing pressure on those vulnerable areas.
Okay.
So think, specialized mattresses, cushions, even strategically placed pillows. It's all about distributing that pressure more evenly
Okay.
to prevent those high pressure points that lead to tissue damage.
And even with those special surfaces, the keep moving part is still super important.
Oh, absolutely. That's key.
So what does that entail?
Regular repositioning, that's essential.
Okay.
Whether it's turning a patient every 2 hours in bed or encouraging someone in a wheelchair to shift their weight every 15 minutes.
Yeah.
It's like giving those blood vessels a break and allowing oxygen to reach the tissues.
Makes sense.
Keep that blood flowing.
Okay, and then we have incontinence management.
Yes, that's a big one.
So why is this important?
Moisture from urine or stool can really damage the skin,
Okay.
makes it more susceptible to break down. Think of it like constantly soaking a piece of paper. It weakens and it tears easily.
Oh, yeah, that makes sense.
So we want to keep that skin clean and dry.
So what are some strategies?
Well, you might need to address the underlying cause of incontinence if possible.
Okay.
Offer frequent toileting opportunities, using absorbent products, applying barrier creams to protect the skin.
Okay.
It's all about minimizing the damage that moisture can cause.
Right. And then last but not least, nutrition.
can't forget about nutrition.
Right, so what's the connection to wound care?
Think of your body like a construction site.
Yeah.
If you don't have the right building materials,
Mm-hmm.
the project's going to stall.
Right.
Wound healing requires adequate protein, calories, vitamins, and minerals.
Okay.
It's like making sure the construction crew has all the bricks and mortar and the tools they need.
To do the job.
Exactly. Got to have the right supplies.
So a balanced diet is really key.
It is. It provides those building blocks for wound repair.
And the presentation even calls out specific nutrients,
Oh,
like
yeah.
vitamin C,
Mm.
which is essential for collagen production.
Collagen is like the steel beams holding everything together.
Makes sense.
Gotta have strong beams.
It's amazing how much thought and attention to detail goes into preventing these pressure ulcers.
It really is. It's a whole process.
Yeah,
But it's important.
it is.
It's a reminder that even small things,
Mm-hmm.
like repositioning a patient or ensuring adequate nutrition,
Mm-hmm.
can make a huge difference in preventing these wounds.
And potentially devastating wounds.
Absolutely.
So to identify those who are most at risk, they introduce a tool, the Braden scale.
Yes, the Braden scale.
Yeah, so what is this?
It's like a risk assessment checklist.
Okay.
It looks at 6 key factors.
Okay.
Sensory perception, moisture, activity, mobility, nutrition, and friction and shear. Each factor kind of contributes to the overall risk of developing a pressure ulcer.
So the lower the score, the higher the risk.
Exactly. Lower score, higher risk.
Okay.
But it's important to remember
Mhm.
that it's not enough to just assess the risk.
Right.
You have to act on it.
Okay, so what do we do?
If someone scores low on the Braden scale,
Mm.
implement those skin strategies that we just talked about.
Right?
That's key to mitigate that risk and prevent those ulcers from developing.
Okay, so it's like seeing storm clouds on the horizon
Yeah.
and taking steps to batten down the hatches.
Exactly. Be prepared.
Right. Okay, this is so interesting. So pressure ulcers are definitely a serious concern,
Mm-hmm.
but the presentation doesn't stop there, right?
Of course not. There's so much more to cover.
Right. It goes on to discuss other skin disorders,
Mhm.
starting with some common ones: fungal infections, abrasions, and skin tears.
Usual suspects.
Yeah, so it doesn't go into a ton of detail on each one,
Mhm.
but it does provide some key takeaways.
Some good nuggets of information.
Exactly. So let's start with fungal infections,
Okay. Fungal infections.
often called yeast rashes.
Yeah. Yeast rashes.
So what should we be looking for?
So look for solid rashes with what we call satellite lesions.
Satellite lesions.
Yeah. So imagine like a main island
Okay.
surrounded by smaller islands.
Okay.
That's what a fungal rash with satellite lesions looks like.
Okay, that's a really clear visual.
It is. It helps you remember.
Yeah, and they really emphasize moisture control with these, right?
Oh, absolutely. Moisture is the enemy.
Yeah, so these infections thrive in, warm, moist environments.
Exactly. Think sweaty skin folds, damp socks,
Yeah.
or even just, humid weather.
Yeah, so they suggest, using dry cloths
Mm-hmm.
or gauze in skin folds,
Yeah, keep it dry.
right, to absorb that excess moisture.
Gotta wick that moisture away.
Yeah, and then they recommend treating the rash with an antifungal medication.
Yeah, get those antifungals working.
Okay, so we've got fungal infections covered.
Jake.
What about abrasion?
Abrasions, those are fun.
Yeah, we've all had them.
It's like, taking sandpaper to your skin.
Yeah.
You're basically scraping away that top layer of skin, the epidermis.
Okay.
And it happens more easily when the skin is fragile,
Mm-hmm.
or what we call macerated.
Macerated.
Yeah, it basically means waterlogged.
Okay.
So the skin is all kind of soggy and weak.
That's why those, rug burns from childhood
Yeah.
seem to happen so easily.
So easily, that skin is delicate.
And finally, skin tears.
Ouch, those are painful.
Yeah, they sound painful.
It's like tearing a piece of delicate fabric,
Oh, yeah.
And skin tears happen when fragile skin is dragged or pulled,
Okay.
especially in older adults because their skin is thinner
Yeah.
and less elastic.
Makes sense.
They really stress the importance of careful handling
Mm-hmm.
and using proper lifting techniques to prevent skin tears in those vulnerable individuals.
Right, so it's like handling a delicate antique.
Exactly. You got to be careful.
You gotta be gentle.
Gentle and use the right techniques to avoid causing damage.
Okay, so we've got abrasions and skin tears.
Yeah.
What about contact dermatitis?
Contact dermatitis.
So what is that exactly?
Think of it like an angry reaction to something your skin doesn't like.
Okay.
It could be a chemical, a fragrance, or even something as seemingly harmless as soap.
Interesting.
And the skin becomes, red, itchy and inflamed.
And they actually specifically mention enzymes as a potential culprit.
Oh, yeah. Enzymes can be trouble.
Yeah, so they explain that enzymes from incontinence or wound drainage can actually strip away the skin.
It's pretty wild.
Yeah, and that leads to what they call denuded skin.
Denuded skin.
Yeah, so what's that?
So that's like having a raw, exposed patch.
Oh, no.
And it can be incredibly painful because the protective barrier of the epidermis is gone.
So the underlying tissue is just exposed.
Exposed and vulnerable to infection and further damage.
And they contrast that with excoriated skin, which is basically like scratch marks.
Right. Yeah, basically.
So excoriated skin can be uncomfortable, but denuded skin sounds way more serious.
It is, because that entire top layer of skin is gone.
Yeah. Okay, so recognizing the difference between those two types of skin damage is important.
Absolutely. Got to know what you're dealing with.
Okay, let's shift gears now to a category of wounds that often presents unique challenges.
Okay, I'm intrigued.
Vascular wounds.
Vascular wounds, all about blood flow.
Or lack thereof.
Exactly.
And they typically affect the lower extremities.
Right, legs and feet.
Yeah, and they're closely tied to problems with the arteries and veins.
Those crucial pipelines of the circulatory system.
Right, so to really grasp vascular wounds, we need to understand the difference between arteries and veins.
Absolutely, got to have that foundation.
Okay, so arteries, veins, break it down for us.
Okay, so imagine this. Arteries, they're like the delivery trucks
Okay.
of the circulatory system, carrying oxygen-rich blood from the heart to the rest of the body.
Right.
And then veins, they're like the return trucks,
Yep.
bringing that deoxygenated blood back to the heart to be replenished.
So it's all about that smooth two-way traffic.
Exactly, got to keep things moving.
And when that traffic flow gets disrupted, it's like a roadblock on a busy highway.
Chaos, everything backs up.
And that chaos can manifest as these stubborn vascular wounds.
It can lead to all sorts of problems.
Well, let's break down the two main types of vascular wounds.
Okay.
Arterial and venous ulcers. Starting with arterial ulcers, what causes them?
So arterial ulcers are caused by insufficient blood flow
Okay.
to the tissues,
Okay.
usually because of narrowing or blockage of the artery.
And we talked about atherosclerosis before, which is that buildup of plaque inside the artery.
Right, that's a common culprit.
So it's like those arteries are slowly like becoming clogged pipes.
Exactly, the blood just can't get through as easily.
And when the tissues don't get the oxygen and the nutrients they need, they start to cry out in pain.
They do, they let you know something's wrong.
So those classic symptoms of arterial ulcers, pain, pale skin, cool temperature, that's like a sign of those tissues screaming for help.
They're sending out an SOS.
Yeah, and the ulcers themselves often have that punched-out appearance.
Right, they have well-defined edges and a pale wound bed.
It's like the tissue's been starved of its lifeblood.
A powerful image.
Yeah, and they actually include a striking image in the presentation
Oh, I bet.
of a 65-year-old woman with an arterial ulcer. And it really shows how quickly these wounds can deteriorate.
It can be scary how fast it happens.
Yeah, it's a reminder to seek prompt medical attention.
Absolutely, don't wait.
And they emphasize a really important point, debridement, which is the removal of dead tissue.
Right.
Should not be done on dry, uninfected arterial ulcers until the blood flow is restored.
That's key.
So why is that?
Well, think about it. If the blood supply is already compromised, removing tissue is only going to further damage the area.
Okay.
So the priority is to restore that circulation.
Right. Clear that traffic jam.
Exactly. Get those deliveries moving again.
So that might involve lifestyle changes, medication, or even surgical procedures.
Whatever it takes to get that blood flowing.
Okay, so arterial ulcers, we've got those covered.
What's next?
Venous ulcers.
All right, venous ulcers, a whole different ballgame.
Yeah. So what's the story with those?
So venous ulcers, they're caused by venous insufficiency,
Okay.
meaning the veins aren't effectively returning blood back to the heart.
Okay.
So think of it like a backup in those return trucks, causing blood to pool in the legs.
Because like a traffic jam on those back roads.
Exactly, and that causes all sorts of problems.
Yeah, so that increased pressure in the veins causes problems, right?
It does.
Like what?
Well, it damages the capillaries, those tiny blood vessels, and it causes them to leak fluid into the surrounding tissues.
So that leads to swelling or edema.
Exactly, and it makes the skin fragile,
Okay.
prone to ulceration.
And they describe it as the leg looking like an upside-down bottle.
I've heard that one. It's a good visual.
Yeah, because of that swelling.
Right. All that fluid buildup.
And the ulcers themselves,
Mm-hmm.
how do they differ from arterial ulcers?
Well, they typically have irregular edges
Okay.
and a shallow, ruddy wound bed.
Yeah.
And they're often less painful than arterial ulcers.
Okay.
Unless they become infected.
Okay, and the treatment is quite different, right?
Oh, yeah. Very different.
So what's the approach for venous ulcers?
The cornerstone of venous ulcer treatment is compression therapy.
Compression therapy. So what is that?
So it's like giving those return trucks a helping hand,
Okay.
squeezing that excess fluid out of the tissues,
Okay.
encouraging blood flow back to the heart.
So it's like wearing compression stockings or bandages.
Exactly. They provide that extra support,
Okay.
helping the veins do their job.
And the presentation says that venous ulcers are very unlikely to heal without compression therapy.
It's essential.
So compression is like the traffic cop, directing the flow of blood,
I like it. It's a good analogy.
keeping those back roads from, getting too congested.
Got to keep things moving.
Okay, so we've got arterial ulcers, where the problem is, not enough blood flow to the tissues.
Right.
And we've got venous ulcers, where the problem is, inadequate blood return.
Yep. Two different problems, same outcome.
Two different mechanisms, both leading to these, challenging vascular wounds.
And they can be tough to treat.
Okay, let's move on to another type of one that presents unique challenges.
Okay, what do we have?
Diabetic wounds.
Oh, yeah, diabetic wounds. Those are a big one.
Right, so these are a serious complication of diabetes, often developing on the feet and resulting from a perfect storm of factors
It's a recipe for disaster.
like peripheral neuropathy,
Oh, yeah, neuropathy is a major problem.
which causes numbness and loss of sensation in the feet.
Right, you lose that protective feedback.
Right, so imagine like losing the ability to feel pain or temperature in your feet.
Scary thought.
Yeah, you might step on, a sharp object, develop a blister from, ill-fitting shoes, or even burn yourself
Yeah,
without realizing it.
it happens all the time.
And because they can't feel those injuries,
Right.
they might not notice them.
And they don't seek treatment.
Right. And then the wounds worsen.
And then you have a much bigger problem.
Yeah. And that's compounded by another common problem in diabetes, poor circulation.
Right, the blood vessels get damaged.
Yeah.
Makes it harder for oxygen and nutrients to reach the tissues.
So it impairs wound healing.
Exactly, it's a double
And
whammy.
then they actually show some pretty graphic images
Oh, I bet.
of infected diabetic ulcers, even ones with bone involvement,
It can get that bad.
to illustrate how severe these wounds can become.
It's a wake-up call.
It is. So it really stresses the importance of meticulous foot care
Absolutely, got to take care of those feet.
for people with diabetes.
Every single day.
So we're talking daily inspections, looking for any cuts, blisters, or redness.
Any little thing.
Proper footwear is crucial.
It is. Got to have good support.
And any sign of a problem, no matter how small,
Mm-hmm.
needs prompt attention from a healthcare professional.
Don't wait. Get it checked out.
And of course, managing blood sugar levels
Yes, that's the foundation.
is, crucial.
Absolutely crucial.
It's the foundation of good foot health
For sure.
for people with diabetes.
It's like keeping the engine running smoothly.
Yeah, preventing those breakdowns.
Exactly. Maintenance is key.
This has been incredibly insightful.
It's a lot to take in.
It is. It's amazing how the presentation manages to, pack so much information into such a concise format.
It's well done.
Yeah.
Yeah, it really is. It's amazing what we can learn.
Just by, looking at a wound in its surroundings.
Exactly, like being a detective, but instead of, crimes, we're unraveling the mysteries of the human body.
Right. And speaking of mysteries,
Oh.
the presentation takes a little detour to touch on a few other skin conditions
Okay.
that might pop up
Okay.
alongside wounds, or even, mimic them.
Interesting. What kind of conditions are we talking about?
So it's like a bit of a grab bag,
Okay.
highlighting the sheer diversity of, skin disorders.
Right. There's a lot out there.
Yeah, so we've got herpes, yeast infections, scabies.
Oh, wow. A real mix.
Yeah, even corns and calluses.
A classy.
So it's like a quick tour of common skin ailments, even if they're not, directly related to wounds.
Just to broaden our horizons.
Exactly.
So it doesn't go into like a ton of detail on each one,
Yeah.
but it does offer, some interesting nuggets of information.
Okay, like what?
So remember those satellite lesions we talked about with fungal infections?
Those little islands.
Yeah, well, the presentation mentions that herpes lesions
Yeah.
can also have a similar appearance.
Interesting. So if you see those clusters of small lesions, it could be a clue to, like, dig deeper
Right.
and consider different possibilities.
Exactly. Got to keep an open mind.
Okay, now let's talk about those corns and calluses.
Ah, yes. The glamorous world of corns and calluses.
I know, not very exciting.
But common.
They're incredibly common. I've definitely battled my fair share of calluses.
Me too. So what causes them?
So the presentation describes them as hyperkeratotic areas,
Hyperteratotic.
meaning areas of thickened skin.
Okay.
So think of it as the body's way of saying, hey, this area is getting a lot of friction or pressure.
Okay.
Let's build up some extra protection.
So they're not, like, inherently bad.
Right. It's like wearing an extra layer of armor.
Interesting. The body's defense mechanism.
Exactly. It's a natural response to repeated stress.
But I imagine they can become a problem, right?
Yeah, if they get too thick or, start to hurt or interfere with daily activities.
Like when you can't walk comfortably because of a callus.
Exactly. So in those cases, a podiatrist or a dermatologist can help, safely remove or reduce them.
Okay, makes sense.
Now, shifting gears a little bit, the presentation revisits skin tears.
Oh, yeah, we talked about those briefly.
Yeah, and it provides some additional insights
Okay.
into their causes, particularly in older adults.
Yeah, those are a big concern for elderly patients.
Especially with their, thinner, more fragile skin.
Exactly. It's like tissue paper.
So the presentation emphasizes that even seemingly minor bumps or scrapes can lead to significant skin tears
Wow.
in older adults.
So their skin is just more delicate.
And less resilient, making it prone to tearing from, friction shearing forces or even just bumping into things.
So we got to be extra careful.
Right. It's like handling, a delicate antique.
You said it.
You got to be gentle and use the right techniques
Absolutely.
to avoid causing damage.
And protect that vulnerable skin.
Exactly. Okay, so you got those, common skin conditions covered.
Right next.
Let's circle back to vascular wounds.
All right, back to those blood vessels.
Those intricate blood vessels that keep our bodies humming.
It's an amazing system.
It is. So it's time to put on our circulatory system hats.
I'm ready. Let's dive in.
And delve into the world of arteries and veins.
The highways and byways of the body.
Exactly. So we touched on, the difference between arterial and venous ulcers before. But let's break those down further.
Okay, idea.
Understanding the distinction is, crucial.
Yeah, it's the foundation.
For both diagnosis and treatment.
Absolutely.
So picture this. Arteries are like the highways of our circulatory system,
Okay, I like it.
carrying oxygen-rich blood from the heart to every nook and cranny of our body.
Got to reach every cell.
Veins, on the other hand, are like the back roads,
Okay.
bringing that deoxygenated blood back to the heart
Right, back to home base.
to be replenished.
Right, got to get reoxygenated.
So a well-functioning circulatory system is all about that smooth two-way traffic.
Got to keep those roads clear.
Exactly. And when that traffic flow gets disrupted,
Oh.
it's like a roadblock on a busy highway.
Everything grinds to a halt.
Right. Things start to back up. Deliveries get delayed. Chaos ensues.
And the body doesn't like chaos.
No, and that chaos can manifest as those stubborn vascular wounds.
It can really throw a wrench in the works.
So let's start with arterial ulcers,
Okay.
those troublemakers, caused by insufficient blood flow
Right, not enough blood getting to where it needs to go.
through the tissues.
And we know one of the main culprits is atherosclerosis.
Right, that buildup of plaque in the arteries.
Like sludge in the pipes.
So those arteries are slowly turning into clogged pipes.
Making it harder and harder for the blood to get through.
And when those tissues don't get the oxygen and the nutrients they need,
Oh, they're not happy.
they start to, cry out in pain.
Literally.
So those classic symptoms of arterial ulcers, pain, pale skin, cool temperature.
Those are all signs that those tissues are in distress.
Yeah, they're sending up a flare.
Exactly. They're saying, hey, we need help down here.
And the ulcers themselves often have that distinctive, punched-out appearance.
Right. Well-defined edges, pale wound bed.
Like The tissue has literally been starved.
Of its lifeblood.
It's a powerful image. And treating arterial ulcers, as we talked about before, is all about restoring that blood flow.
Clearing those arterial highways?
Right, getting those deliveries moving again.
So what does that involve?
So it might involve lifestyle changes, like, smoking cessation.
Right. Got to kick that habit.
Exercise.
Into blood pumping.
Medications to control blood pressure and cholesterol.
Keep those vessels healthy.
Or even surgical procedures.
Sometimes you need to go in and clear the blockage.
To open up those blocked arteries.
Get that traffic flowing smoothly again.
Okay, so arterial ulcers, check.
Check. What's next?
Now let's tackle venous ulcers.
All right, venous ulcers, the other side of the coin.
So these are a different beast altogether, right?
Totally different.
Instead of a problem with the, delivery trucks, it's an issue with the return trucks.
Got it.
So venous insufficiency means the veins aren't effectively carrying blood back to the heart.
Okay.
Leading to a buildup of pressure in the legs.
So it's like a traffic jam, but on the way back?
Exactly, causing congestion and delays.
And that pressure buildup causes problems, right?
It does. What kind of problems?
Well, that increased pressure in the veins weakens the capillaries.
Those tiny blood vessels.
Exactly. And it makes them leaky.
Leaky.
Yeah. Fluid starts to seep out into the surrounding tissues.
Oh, no.
Causing swelling.
So that's where that swelling comes from.
Exactly. It's called edema. And it makes the skin fragile, prone to ulceration.
Right. So you get that classic swelling, that edema, and the skin takes on, a stretched, shiny appearance.
Like it's about to burst.
And eventually those fragile capillaries give way.
And that's when the ulcers form.
And they typically form around the ankles.
Yeah, that's a common spot.
And venous ulcers, they have a different look.
Oh, yeah, they look different.
Than arterial ulcers.
How so?
So they tend to be shallower.
Okay.
With irregular edges and a ruddy wound bed.
Interesting.
And the presentation describes the leg looking like an upside-down bottle.
Because of the swelling?
Yes. It's a great visual.
It is. It really paints a picture.
Yeah, of that, classic presentation.
Of a venous ulcer.
So venous ulcers, often less painful than arterial ulcers, but they can still, significantly impact a person's quality of life.
Absolutely. Imagine dealing with chronic leg swelling, open sores, and difficulty walking.
Yeah, that sounds debilitating.
It can really limit your mobility.
So how do we treat these venous ulcers?
Well, the key is to address the underlying cause.
Which is?
That venous insufficiency.
Right. So how do we do that?
The cornerstone of treatment is compression therapy.
Okay, compression therapy, we talked about that before.
It's all about giving those return trucks a helping hand.
Okay.
Squeezing that excess fluid out, encouraging blood flow back to the heart.
Right, so compression stockings or bandages?
Exactly, they provide that extra support.
Okay.
Helping the veins do their job more effectively.
And they say that compression therapy is essential for venous ulcer healing.
It is. Without it, those ulcers are unlikely to resolve.
So compression is like the traffic cop.
I like that analogy.
Right, directing the flow of blood.
Keep things moving.
Preventing those venous back roads from getting too congested.
And keep those lanes open.
All right, so we've got arterial ulcers and venous ulcers.
Two sides of the same coin.
Now let's move on to another type of wound.
Okay, what's next on the agenda?
Diabetic ulcers.
Ah, yes, diabetic ulcers. Those are a tough one.
They are a significant concern, often developing on the feet.
Right, the feet are vulnerable.
And becoming a source of, chronic pain and disability.
It's a major problem for people with diabetes.
For those living with diabetes.
It's a real quality of life issue.
So it's a complex interplay of factors that contribute to these stubborn wounds.
It's a perfect storm.
So we've got peripheral neuropathy.
Right. The loss of sensation.
Making it difficult to detect injuries early on.
And then the damage just keeps getting worse.
Poor circulation. Impairing the delivery of oxygen and nutrients.
Slowing down healing.
Elevated blood sugar levels.
Right. That creates a breeding ground for bacteria.
Increasing the risk of infection.
So you've got all these factors working against you.
There's a storm brewing.
In those feet.
Yeah, creating an environment where wounds struggle to heal.
And the presentation shows some pretty graphic images.
Oh, yeah, they don't hold back.
Of diabetic ulcers.
Some with severe infections, exposed bone, even amputations.
It's a stark reminder.
It is that these wounds are not to be taken lightly.
Absolutely not. They can have serious consequences.
So it highlights the importance of proactive foot care.
For sure. Gotta be
For people with
rest
diabetes,
of the day.
so we're talking daily inspections,
Mhm.
looking for any cuts, blisters, or redness,
Any little thing.
proper footwear,
Crucial. Gotta have good support.
and any sign of a problem, no matter how small,
Mhm.
needs prompt attention
Don't wait. Get it checked out.
from a healthcare professional.
Exactly.
And of course, managing blood sugar levels
Yes. A foundation.
is paramount.
It's the key to everything
It's the foundation of good foot health.
for people with diabetes.
It's like keeping the engine running smoothly.
Preventing those breakdowns.
Exactly. Got to stay on top of it. This has been, incredibly insightful.
It's a lot to take in, but it's important information.
It's clear that diabetic ulcers require, a multi-pronged approach, addressing both the wound itself and the underlying factors
Right. It's not just about the wound. It's about the whole person.
that contribute to its development.
It's a holistic approach.
So it's a team effort
Absolutely.
involving the patient,
Mm-hmm.
their healthcare providers,
Right. Working together.
and sometimes even, specialized wound care clinics.
When you need that extra level of expertise.
And the goal is to, optimize healing, prevent complications, and ultimately maintain, foot health and mobility.
Keep those feet happy and healthy.
Exactly. Now, while diabetic ulcers often, grab the spotlight, the presentation reminds us about another type of wound
Okay.
that could be, equally challenging.
Which is?
Pressure ulcers.
Ah, yes. Pressure ulcers. Those are always a concern.
Those are a constant concern.
Especially for individuals with limited mobility.
We often associate them with, bedridden patients.
Right. But it's not just bedridden patients.
But they can occur anywhere. There's prolonged pressure on the skin.
Exactly. It could be someone in a wheelchair. Or someone with a cast on their leg. Even someone who sits for long periods.
Without shifting their weight.
Right. It's all about that pressure.
That unrelenting pressure.
Restricting blood flow, damaging the tissues.
So it's not just about, the intensity of the pressure. It's also about the duration.
Exactly. How long that pressure is applied.
And as we discussed before, the presentation, provides a detailed explanation.
It's a good resource.
Of the staging system for pressure ulcers.
Classifying them based on the depth of tissue damage.
And that staging system helps us understand the severity and guide our treatment decisions.
It's a roadmap.
It's like, assessing the damage after an earthquake. A minor crack in the foundation versus a complete collapse of the building.
Two very different scenarios.
Exactly. So let's recap those stages.
All right, let's do it.
Starting with stage I.
Stage I, the early warning signs.
What are the, telltale signs?
So in stage I, you'll see non-blanchable redness.
Okay.
Over a bony prominence.
Okay.
So imagine pressing on a ripe tomato.
Okay.
If the redness doesn't fade, that's a sign that those capillaries beneath the skin are damaged.
And it's important to remember that stage I pressure ulcers can be difficult to detect in people with darker skin tones.
Absolutely. That's a good point.
So careful assessment and palpation
are crucial.
It's not just about looking.
Right.
It's about feeling for any changes in skin texture or temperature.
You've got to use all your senses.
Okay, what about stage 2?
All right, stage 2, the plot thickens.
So how does that differ from stage 1?
So in stage 2, we've moved beyond just redness.
Okay.
Now there's actual skin loss.
Oh.
A partial thickness loss involving the epidermis and part of the dermis.
So it might look like an abrasion, a blister, or a shallow crater.
Imagine a small divot in the earth.
Okay.
That's what a stage 2 pressure ulcer might look like.
So the damage is, more visible at that stage.
It is. It's starting to break through the surface.
And then things escalate further with stage 3.
Oh, yeah. Stage 3 is when things get serious.
What happens?
In stage 3, the ulcer extends deeper,
Okay.
reaching the subcutaneous fat.
Okay.
Think of it as that divot in the earth now reaching down to the bedrock.
Oh, wow.
You might also see tunneling or undermining.
Those channels.
Exactly. Those channels extending from the main wound.
So it's like the damage is, spreading underground.
Making it much more complex to manage.
And then stage 4.
Stage 4, the most severe.
Yeah, that's when things get really bad.
In stage 4, the ulcer goes through all layers of skin.
Wow.
Potentially involving muscle, bone, or tendons.
It's like that earthquake causing a massive sinkhole.
Exactly, exposing everything beneath the surface.
Yeah.
These ulcers are incredibly challenging to heal.
And they can lead to, serious complications.
It can be life-threatening.
And they also remind us about unstageable pressure ulcers.
Right. Those are the tricky ones.
Those that are, covered with eschar or slough.
Making it impossible to determine the true depth
Of the damage.
They're like mysteries shrouded in darkness.
And they specifically mention, stable eschar on the heels. And they say that it should not be removed.
Why not?
Because it acts as a natural protective barrier.
Interesting. So it's like a protective scab.
Yeah.
Shielding the underlying tissues.
It's a reminder that wound care is not always about, aggressive intervention.
Sometimes it's about letting the body do its thing.
Right. Letting the body's natural healing processes take over.
The body's pretty amazing.
It is. Okay. This deep dive into pressure ulcers has been so informative.
It's a lot to take in.
It really highlights the need for vigilant assessment and proactive care.
Especially for those at increased risk.
So prevention is always, the best medicine.
Absolutely. An ounce of prevention is worth a pound of cure.
And the presentation, reminds us of that handy acronym, SKIN.
Ah, yes. SKIN. I remember that.
Surface, keep moving, incontinence management, and nutrition.
Those 4 pillars of pressure ulcer prevention.
It's a simple but effective reminder.
It is.
That, seemingly small things, like repositioning a patient or ensuring adequate nutrition
Can make a world of difference.
Exactly. And while identifying and preventing wounds is, crucial, the presentation also emphasizes the importance of thorough wound assessment.
Right. Gotta know what you're dealing with.
It's like, detective work.
Gathering clues.
To understand the wound story and guide our treatment approach.
It's a process.
So let's put on our Sherlock Holmes hats.
I'm ready to solve a mystery.
And delve into the world of wound assessment.
Let's go.
What are the key elements, that we need to pay attention to?
Well, the presentation provides a comprehensive checklist covering everything from location and size to color, drainage, odor, and the condition of the surrounding skin.
So let's start with location.
Okay, location.
Why is that, important?
Well, knowing the location of the wound could actually provide valuable clues about its cause and potential complications.
So, for example,
a wound on the heel is more likely to be a pressure ulcer, while a wound on the shin might be a venous ulcer.
So it helps us, narrow down the possibilities.
It's like finding a fingerprint at a crime scene.
Right.
It helps us identify the culprit.
Okay, and what about size?
Size matters.
It does. How do you accurately measure, a wound?
Precision is key.
Okay.
The presentation recommends using a disposable ruler
or
a measuring guide to measure the wound's length, width, and depth in centimeters.
Got to be precise.
It's like a cartographer mapping out a new territory.
Right. Accuracy is essential.
Exactly.
And what about depth?
Depth is a little trickier.
Yeah. How do you measure that without, causing further damage?
We use a cotton-tipped applicator to gently probe the wound. Like an archaeologist carefully excavating a delicate artifact.
Right. Got to be careful.
We want to determine the deepest point without forcing the applicator into any tunneling or undermining.
Speaking of tunneling and undermining.
Ah, yes, the hidden passageways.
They can be tricky to detect.
They can be sneaky.
They're like hidden passageways beneath the surface.
Exactly. They might not be immediately apparent.
So it's essential to gently probe those wound edges to assess for their presence.
Feel around, see what's going on.
Think of it like, exploring a cave.
Okay.
You need to proceed cautiously.
Don't want to cause a collapse.
Right. And how do you document, tunneling and undermining in a way that's clear and concise?
Well, the presentation recommends using a clock face to describe their location and extent.
So imagine the wound as a clock face.
Okay.
And you can pinpoint, the tunneling or undermining.
Using the hour markers.
Exactly. So, for example, you might say...
tunneling present at 3 o'clock.
Extending 2 centimeters.
Exactly. Nice and clear.
That's a great way to visualize it.
It is. It makes it easy to understand.
Okay, now let's talk about color.
Color, one of the most important clues.
We already discussed how wound color can provide clues about the healing process.
It is language.
But what are the, specific colors that we're looking for?
So a healthy wound bed is typically beefy red,
Okay.
indicating the presence of granulation tissue.
Right, that vibrant, new tissue.
That's rebuilding the damaged area.
It's a sign that things are progressing as they should.
A good sign.
And what about other colors?
Well, yellow or tan often indicates slow, which is, soft, devitalized tissue.
So that needs to be removed.
To allow for healthy healing.
Okay.
And black usually indicates eschar.
Right, that hard, dry, necrotic tissue.
Like a scab, sometimes protective, sometimes needing to be removed.
And they actually show a picture of an unstageable pressure ulcer with eschar. And they explain that you may or may not debride the eschar.
Depending on the location.
That's a crucial point.
It is.
That wound care is not, a one-size-fits-all approach.
Every wound is different.
Each wound needs to be evaluated individually.
Considering its location, the patient's overall health.
Right. There are a lot of factors.
It's a complex puzzle.
So color is like a language.
It is.
Telling us about the state of the wound.
Guiding our treatment decisions.
Now let's move on to drainage.
Drainage, another important clue.
So what are the key characteristics that we're assessing?
We're looking at the amount, the color, and the consistency.
For drainage.
It's like analyzing a fluid sample in a lab.
Gathering clues about what's happening beneath the surface.
Exactly. It's detective work.
So periwound drainage is clear and watery.
Like the fluid from a blister.
Sanguineous drainage.
That's bright red.
Indicating fresh bleeding.
Serosanguineous draining.
That's a pinkish mixture.
Of the two.
And then purulent drainage.
That's the one we don't want to see.
Yeah, so that's thick. Often yellow, green, or brown.
And it can be a sign of infection.
So drainage is like a window
into the wound,
giving us insights into the healing process.
And alerting us to potential problems.
So it's essential to monitor drainage carefully.
Absolutely.
And report any concerning changes.
As a healthcare provider.
And what about odor?
Odor, another important sense.
So is that something we should be paying attention to?
Definitely a foul odor can indicate infection. Or the presence of necrotic tissue.
So while a mild odor might be associated with certain wound care products.
Right. Some products have a distinct smell.
A strong, unpleasant odor.
That's a red flag.
Okay, so wound assessment involves all of our senses.
It does. Sight, touch, and smell.
We're gathering information
from every possible source
to create a comprehensive picture of the wound.
And guide our treatment decisions.
And finally, what about the skin surrounding the wound?
The surrounding skin, that's important too.
Why is it important to assess that?
Well, the condition of the surrounding skin can provide valuable insights into the wound's overall health and the effectiveness of our treatment plan.
So it's like, assessing the ecosystem.
Around a plan.
If the soil is healthy, the plant is more likely to thrive.
Exactly. It's all connected.
So we're looking for any signs of inflammation, infection, maceration.
Right, any problems that could be hindering the healing process.
Exactly. The surrounding skin can tell us a lot.
About what's happening beneath the surface.
And whether our interventions are working.
It's feedback from the body.
This deep dive into wound assessment has been, incredibly eye-opening.
It really is. Wound care is a complex field.
It is, but ultimately it's about, understanding how the body heals.
Right.
And creating the, optimal environment for that healing to occur.
Setting the stage for success.
Now, the presentation doesn't, sugarcoat the reality of wound care.
It's not always easy.
No, it acknowledges that wound healing can be, a long and challenging journey.
It can be.
Especially for chronic wounds.
Like diabetic foot ulcers.
And venous leg ulcers.
This can be really stubborn.
Yeah, so chronic wounds are a different beast altogether.
They are. They're a different animal.
They involve, underlying medical conditions.
Often multiple conditions.
Right, impaired circulation.
Higher risk of infection.
And they require, a specialized approach.
And a lot of patience.
Sometimes
it feels like you take one step forward, two steps back.
Yeah, it can be frustrating for both the patient and the, healthcare provider.
Absolutely. It's a team effort.
So it's like navigating a complex maze.
You need a good guide.
Requiring, expert guidance and a persistent spirit.
Don't give up.
And the presentation emphasizes the importance of seeking care.
From the right people.
From a healthcare professional.
With expertise in wound care.
If you're dealing with, a chronic wound.
It's not something you want to try to tackle on your own.
No, you need that specialized knowledge.
So find a wound care specialist.
Right, someone who can assess the wound,
Identify any underlying factors,
contributing to its persistence,
and develop a personalized treatment plan.
and they can provide ongoing support
Education.
to help patients manage their wounds effectively.
Them the tools they need to succeed.
This deep dive into wound care has been, so eye-opening.
It's a fascinating field.
It's amazing how much detail goes into, properly caring for a wound.
It's not just slapping on a bandage.
No, it's a science.
And an art.
Now, as we delve deeper into this presentation,
What's next?
one crucial aspect of wound care demands our attention: infection.
Ah, yes. Infection. The enemy of wound healing.
Infection is a formidable foe.
It can really derail the whole process.
It can derail the healing process, prolong pain.
And even lead to life-threatening complications.
So let's equip ourselves with, knowledge
Knowledge is power.
and explore the battleground of wound infections.
Let's suit up.
What are the warning signs?
So the classic signs of infection, they're like red flags waving,
Signaling that something is amiss.
trouble brewing.
So we've got redness, swelling, heat, pain,
The cardinal signs of inflammation.
increased drainage.
That tells us the body is fighting an intruder.
So any of those signs could indicate, an infection brewing.
Absolutely. It's the body's way of saying, hey, something's wrong here.
And the drainage might, change,
How so?
become thicker, cloudier, or foul-smelling.
It's like the wound is sending out a distress signal.
Yeah, saying, help, we've got a problem here.
And sometimes the
Okay.
patient might develop a fever
Okay,
as their body mounts a full-scale defense.
right. It's like the body's thermostat is cranked
We'll
up.
have to burn out the infection.
So vigilance is key.
Absolutely.
We need to be on the lookout for any changes
In the wound's appearance.
or the patient's symptoms.
Don't ignore those red flags.
Early detection and treatment are crucial.
To prevent those minor skirmishes from turning into full-blown wars.
Okay, so let's talk about the enemy.
Who are we fighting?
What are the usual suspects behind these wound infections?
So most wound infections are caused by bacteria.
Bacteria, those microscopic invaders,
They're everywhere.
they're everywhere, on our skin, in the environment.
Even on seemingly clean surfaces.
So it's like an invisible army lurking,
Waiting for an opportunity to strike.
waiting for an opportunity to breach our defenses.
And when they find a wound,
An open door.
they seize the opportunity.
And some wounds are more vulnerable to attack than others,
Absolutely. Some wounds are like welcome mats.
inviting them to set up camp.
And cause trouble.
So wounds that are deep,
Hmm.
contaminated, or have a lot of, dead tissue,
Those are prime targets.
they're more susceptible to infection
It's like a buffet for bacteria.
in people with weakened immune systems.
Right. Their defenses are compromised.
Whether due to age,
illness,
medication.
they're more vulnerable to attack.
So knowing the risks, how do we prevent these, microbial invaders
Prevention is key.
from wreaking havoc on our wounds?
Well, the presentation emphasizes a multi-pronged approach,
All right.
starting with, the foundation of good wound care, aseptic technique.
Aseptic technique, it sounds almost surgical.
It's all about minimizing the risk of introducing bacteria.
So it's like creating a sterile operating room.
Even if you're just changing a bandage at home,
So hand washing,
First of all-
wearing gloves,
always
using sterile
it's
instruments
the basic steps.
that often get overlooked.
But they're so important.
So it's like creating a protective bubble,
Around the wound.
shielding it from those invisible enemies.
Exactly. Keep those bad guys out.
Then there's thorough wound cleansing.
Right. Gently removing debris and bacteria.
So it's like giving the wound a gentle bath.
Washing away those potential troublemakers.
And we can't forget about debridement,
Debridement, getting rid of that dead tissue.
which is a breeding ground for bacteria,
It's like clearing out the underbrush in a forest.
making it harder for those invaders to hide and multiply.
Gotta make it inhospitable.
And then there's choosing the right dressing,
Right. The dressing is like a shield.
protecting the wound from the outside world.
Creating the optimal environment for healing,
And in some cases,
especially for high-risk wounds.
for patients with compromised immune systems.
Prophylactic antibiotics might be prescribed.
So it's like sending in reinforcements,
Boosting those defenses.
preventing those opportunistic bacteria from gaining a foothold.
Gotta stay one step ahead.
But what happens when those defenses fail?
An infection takes hold.
How do we fight back?
Well, the treatment approach depends on the severity of the infection.
Okay, so for mild infections,
Topical antibiotics or antimicrobial dressings.
Might be sufficient.
A targeted approach.
Hitting those bacteria right at the source.
But for more serious infections, systemic antibiotics might be necessary.
Okay, so those are the powerful drugs
That circulate throughout the body.
taking on the infection.
From within.
Full body assault.
And in some cases...
Surgical intervention.
So that's like sending in the ground troops.
Performing a strategic operation.
To remove infected tissue.
And give the body a fighting chance.
So surgery might involve cleaning out the infected wound.
Draining abscesses.
Or even amputating a limb.
If the infection is life-threatening.
Ooh, wow, that's a last resort. It is, but sometimes it's necessary to save a life.
So it's a reminder that wound infections are, not something to be taken lightly.
They can have serious consequences.
If left untreated.
Absolutely. Don't mess around with infection.
Early detection
and treatment are crucial. They can make all the difference.
This discussion about wound infections...
It's been eye-opening.
...has been incredibly insightful.
It's a reminder that wound care is a constant battle
against invisible enemies.
And knowledge is our most powerful weapon.
This deep dive has truly opened my eyes
to the complexities.
And challenges
of wound care
involved in wound care.
It's a fascinating field.
From understanding those intricate processes
of wound healing
to navigating the minefield of potential complications.
Like infection.
And it's inspiring to see the dedication
and expertise
of those who specialize in wound care.
They're the real heroes.
Constantly seeking new ways to improve patient outcomes.
It's a field that's always evolving.
And to our listener, we hope this deep dive has been, as enlightening for you.
As it has been for us.
Remember, knowledge is power.
Absolutely.
The more you understand about wound care,
the better equipped you'll be.
The better equipped you'll be to promote healing.
Prevent complications.
And advocate for yourself or your loved ones.
Be an informed patient.
And never hesitate to seek guidance.
From a healthcare professional.
If you have any concerns about a wound,
they're there to help.
They can provide expert assessment.
Personalized treatment plans.
Ongoing support.
To help you navigate this complex world.
Of wound care.
It can be overwhelming, but you don't have to go it alone.
A huge thank you, once again,
to London Heartbeats E-Academy UK
for providing the educational material
that sparked this fascinating conversation.
Don't forget to explore their website.
Over 150 incredible courses.
And subscribe to their social media channels.
Facebook, Instagram, Spotify, and YouTube.
For free updates and future discussions like this one.
Stay connected, stay informed.
And to our listeners, thank you for joining us
on this deep dive
into the world of wound care.
It's been a pleasure.
We hope you found it informative,
engaging,
empowering.
Until next time, stay curious.